or not to Kegel during pregnancy? I'm sure you all have been getting mixed reviews on this. Some are saying definitely yes, some are saying absolutely not, and you're wondering what you should do. And the reason why these are such conflicting answers is because the answer is it depends. I had to put my white coat on for this one. Let's dive into this. It depends on your pelvic floor. Like any other muscle in the body, it needs to be able to fully contract and relax. Let's take our hamstrings for an example. It needs to be able to contract to lift my leg in order for me to walk and run. But it also needs to be flexible to be able to relax and lengthen when I bend down to pick something off the floor. But I wouldn't focus on strengthening if my hamstrings were so tight that they caused me pain or I had a contracture. If my hamstrings were so tight I couldn't straighten my knee, I would focus more on stretching to return my hamstrings back to normal so they could function properly, and then focus on strengthening if needed. The pelvic floor needs to be able to contract and relax as well. Let's take a look at the functions of the pelvic floor to try to arrive at our answer. We need strong pelvic floor muscles to be able to keep the organs in place and to support a growing uterus. When our organs slip down, that's what we call a prolapse. We also need strong pelvic floors to be able to keep things in, like pee, poop, and gas. But we need our pelvic floors to also be able to relax, to release those things when it's time. We need our pelvic floors to relax for any type of penetration, like vaginal exams or intercourse. If our pelvic floors have too much tension and are unable to relax, these things will be painful. We also need our pelvic floor to relax and lengthen and stretch so a baby can come out of our vaginas without tearing. If you have any pelvic floor dysfunction at all right now, basically that's a fancy way of saying it's not acting right. You have pain, incontinence, etc. Talk to your doctor, your midwife, to see a pelvic floor therapist now. You don't have to wait till after birth. If your pelvic floor is doing all right, then it's safe to do Kegels in your first and second trimester. Make sure when you Kegel, you are fully relaxing the pelvic floor afterwards. In your third trimester, though, we need to focus on relaxing, stretching, lengthening the pelvic floor because a baby is about to come out of there. Side note, your uterus contracts during childbirth, not your pelvic floor. That thing needs to be relaxed. Around 32 weeks, you want to start doing something called a reverse Kegel. So sitting on a yoga ball, you can feel this a little bit more. Inhale, fill the belly up with air, and as you do that, your pelvic floor naturally drops down and lengthens. If you have trouble feeling this, try this. Inhale to prepare, exhale, do a slight Kegel just to connect with your pelvic floor, followed by a long inhale to lengthen and stretch the pelvic floor. You could also practice this in a child pose or any position you plan to give birth. Once you master this, you can add a little push down with the reverse Kegel. Looks like this. This is best to try the next time you have a bowel movement. To perform, fill the belly up with air, feel the pelvic floor lengthen, and then you exhale. As you exhale, the belly will naturally come in, so you contract your abdominals while keeping the pelvic floor in the lengthened position. Gently push down like having a bowel movement or laying an egg, because we do that all the time. Again, if these cause any pain, discomfort, incontinence, dysfunction, go to a pelvic floor therapist. I hope that answers your question.